in, but they can definitely catch up and join us. For those of you that don't know me, my name is Leslie Ryan. I'm the Care Services Director with the Rocky Mountain Chapter, and it's my pleasure to welcome you today. Before we begin, I do have a few little housekeeping details. First and foremost, restrooms are right back under that green exit sign in that back corner, and they're nice and big and easy to find. We don't have real set breaks throughout the day. It's not like every hour we're getting up and changing speakers or anything like that. If you need to take a break, feel free to get up, get what you need, head to the bathroom, whatever. Vendors. We have a lot of vendors here today. This really represents the support we have from the community in the area and throughout the state. And the vendors have all paid to be here today. Many of them are speaking throughout the day. Many of them brought giveaways to give to you guys. And we really need to show them our appreciation by spending time talking with all of them. They all have resources that are pertinent to every one of you at some point in the disease process in some way or another. And they all have a lot of experience working with a lot of families living with ALS. So I want to personally thank them all for being here and really encourage you guys to stop by, talk to them. We'll have a lot of time later this afternoon to try everything out. You can ride the stair glide up and down, you can get on a lift, you can play in the wheelchairs. This is a really interactive time and our vendors are a part of that. Each table will have a table host sitting with you. And these people have volunteered today to sit with you. They'll get you a cup of coffee, get you some water, get you another cinnamon roll or a muffin, whatever you may need so that you don't have to get up and miss something, and just to make your life a little easier. They're also available for questions and to kind of encourage you to participate in the day. And then we also have a lot of volunteers here scattered throughout the building. They're all wearing name tags that are similar to yours, except at the top in red they say "Ask Me." Please ask any of them. And if they don't know the answer, they will figure it out. But you can definitely ask any volunteers for help with whatever you may need. Also, please ask the staff for any help. I'd like to introduce and thank our staff that's here today. Suzanne Shrug, who I'm sure you guys all know and love very well, our Care Service Coordinator. Pam Rush-Negri, she's our Executive Director. She's in the back of the room. And Mary King, who is our Extra Hands Volunteer Coordinator, she was upstairs doing registration. So feel free again to ask any of us for anything you may need. And now let's get to the good stuff. It's my pleasure to introduce Sarah Ingalls to you. As the Director of Operations for Senior Helpers in Denver, Sarah oversees marketing and operations. She has a long history in healthcare management and works hard to ensure quality services for all clients. I know that very, very well. Some of you may know Sarah from previous symposiums. She taught this one last year, and she has presented at some of ours previously as well. And she's been a strong supporter of the association for many years and has a true passion for helping people with ALS. She's an active member of our board of directors, and she's also on our Care Services Committee. We're so thankful that she was willing to give up all of her time. It takes a lot of time to put together and develop this entire presentation and coordinate all of the speakers, and also just to be here today to present. So thank you, Sarah, very much.
Thank you.
And without further ado, I'll bring you up.
Perfect, thanks. All right, well, thank you all for being here. And like Leslie said, please feel free to get up and move around at any time. We want this to be very interactive. Am I too loud? I have a really loud voice, so I can move it down if I start breaking your eardrum. Someone just point to your ear. We want it to be very interactive, so if you have questions, please holler. Again, if I don't see you, get your table host's attention to just interrupt me. The whole purpose of this is for you, and so we want to make it as enjoyable and interactive as we can. And I thought we would start off, because it's Saturday morning and we're all here really early, with a drawing. So I'm going to have Lindsay Ray come on up here with United Seating and Mobility, and she is going to do a giveaway. And what better way to start a Saturday morning, huh? Other than Starbucks, but we've got great Starbucks back there too, so I'll let you draw.
Let me draw.
And then you can take it away.
Thank you. I'm going to wait to, is this on? Nice. I'm going to wait to read the name in a second. I'm Lindsay Ray with United Seating and Mobility. Just a little bit about United Seating. We are a national company. We provide high-end custom rehab equipment. We'd be happy to help you guys answer any questions about insurance, equipment, what happens with authorizations and how that process works. We have 3 locations here in Colorado, Denver, Grand Junction, and Colorado Springs. And with that, we're able to do outreach to the entire state of Colorado. We enjoy working with ALSA. We've been working with them for a very long time. And a lot of what we do is help them get equipment to everybody throughout the state when we can, some loaner equipment, and just to be a resource for them and help reach out to you guys where they might not be able to get there as soon as possible. So thank you all for having me too. But I have a gift card to Carrabba's for Peggy Force.
Peggy, yay! Congratulations, Peggy. No, yeah. She would like to. Oops. That's right, only one time.
Thank you so much.
She was going to help him put your card back in again, so she's stacking the deck. And I did want to tell you, I don't know if anyone was here last year, or if you remember, I started off the year by running to help someone in the bathroom and twisting my ankle and breaking it at the beginning of the symposium. So this year I'm recovering from rotator cuff surgery a few weeks ago, so I'm not wearing my sling, but if you notice, I'm not going to be doing the fall participations, and I might stand a little funny sometimes or have an ice bag on me. So I just wanted to explain, I'm not trying to be non-helpful today, but I'm following doctor's orders, and my mom's a nurse and she's watching me today. So, all right, well, let's get started. And again, feel free to interrupt me as we go. We're going to cover the blueprint first. And what we're going to talk about today, and just to kind of set some groundwork before we move on, is that everybody who has ALS, it's different. And I think if you know the disease for yourself, or if you go to some of the different support groups, or if you know anybody else who has it, you understand that process. But for some people who only see kind of their own situation, they don't understand that it progresses very differently. There's different onsets, obviously. The speed of progression makes a big difference in some of the things that we're going to talk about today. Personal choices as well. Some people want to use a lot of aids, other people choose not to. I think that it's really important that today we're not saying that you have to choose any of these things. We want you to know what your resources are. We want you to know what's available to you. There are a lot of things that are customizable that we're talking about today for your specific care and how you choose your life to be. So please remember that this is about your life and your choices. We just want to make sure that we're putting all of those tools up front and making some of the things easier. So last year we kind of covered at the end and talked about kind of the perfect caregiver scenario. And when we're doing the symposium this year, we're talking to everyone who has ALS and everyone who is a caregiver or family member. So we're going to kind of use those interchangeably. But one of the things I always want to talk about, because I think it's really important, is as a caregiver, because that's one of my passions, that's what my company does, that's what I care about, is this how we see ourselves as a caregiver? Do we have this fantasy that we're very well rested, that we always have our best behavior, that we're always patient, we're always kind? And as a patient or the one receiving care, do we have a fantasy that we are always the one who is very gentle? We say please and thank you, we're gracious, we're not demanding. Again, I don't mean to put myself in anyone's position who has ALS, but you know, when I had my surgery, I, until yesterday, could not move this arm, could not move this arm entirely for 6 weeks. And so I had to have someone pull up my pants and put on my bra and do all of the things that are very uncomfortable. And I sometimes was not the best patient. And so I really had to look at myself. Sometimes this is us. We're a little burned out. So some of the things that we're going to talk about today are to give us tools so that we're not burned out Betty here, because that can happen very easily. And the concept is, if you were hiring a caregiver, let's say you were interviewing someone to take care of yourself or the person you care about, is this the person you want to hire? We're interactive, by the way. Thank you. No, we don't want to hire this person, right? So we need to make sure we're rested, that we take care of ourselves. So while there's a lot of talk today about, tools for living with ALS, we're going to talk about tools for dealing with ALS as well. So keep that in mind. You also got a bag when you came in, and I was going to throw this in the air. Oh, yay. I was going to say with my left hand, I didn't know if I could catch it. So pull out your bag. This is your toolkit. We wish we had toolboxes for everybody, but we couldn't find them. So you get an ALS bag instead. This is a stress ball. And the reality is that this is life, isn't it? We're pushed sometimes to the brink, and we're stressed. And although this isn't going to solve your problems, it's a reminder, and we're going to use your kit today, so keep your bag handy throughout the presentation, that this is really sometimes what happens to us as individuals. Squeeze your ball. Do you feel like that sometimes?
Yes.
You're just going to squish out your ears because there's nothing left to give? So this is a reminder of we don't want to be this person. We want to be this person because this person is whole. This isn't right. So if you're living your life like this, we need to make some changes. Because you can't be the best caregiver that you can be, and you can't be the best one receiving care if you're constantly underneath this. So keep that in mind as we keep going. So when we're talking about care, and we're going to cover some of these things really briefly, we're mainly going to talk about more actual, how do you live with ALS, what are the physical kind of daily care pieces. But there are things we don't think about. Physical. Obviously, those are things we take care of first, right? Bathing, dressing, eating, all of those things, those happen first priority. Then probably the emotional we handle, because if we're having a bad day or a rough day, you can't really hide that, regardless of if you're a caregiver or receiving care. Mental, sometimes. We all need to be needed. We all need to have a purpose. Do we sometimes forget about that when we're so busy providing care that we forget that we actually need a purpose? So that's important too. Spirituality, most of the time we keep that in the forefront. We get a lot of support from whatever your belief is. How about sexual? That's uncomfortable. Everybody got quiet. Is that something we talk about, is sex? We should. Especially if it's your partner, if it's your spouse. We put all of our hands on and we do all this hands-on care. And so at the end of the day, we've had our hands on our spouse all the time, but is it the same way? Not at all, right? It's not holding hands, it's not putting your arm around someone, it's not sexual. And we know with this disease that those sensations are some of that they're still there the entire time. So we can't forget about that relationship. We can't forget about that sexual relationship. How about independence? I can tell you right now, I haven't driven in 6 weeks, and I actually just pulled up my pants myself for the first time and buttoned them yesterday. That's pretty horrible. So if it takes me 5 extra minutes to pull up my pants, and Lisa over here has been helping me at work, going to the bathroom with me to make sure that I can get in and out okay, should she give me an extra 5 minutes if that's what I need to do it myself? But is that hard sometimes when she's got things to do? So 5 minutes can make the difference between us feeling independent and someone not feeling independent. How about goals? Have you ever sat down as a family and said, what are your goals through this process? Has anyone ever done that? I suggest that you do. Are your goals for this process to be with family? Is your goal to work as long as possible? Is your goal to take trips that you want to do? What are your goals, and how do you structure life around that? I think we get so busy sometimes dealing with the day-to-day, and I'm not saying that that's not an issue, it is. But we can't forget about the goals that we have. The goals that we have as a family, they're still there. What about the goals of our children, or our parents for our life, depending upon where you're at in your family structure? And bottom line is, we're about a team today. We're going to talk about being a team. And that's really important through this, is that you're not alone. You've got resources. You're a team in your own family dynamic. But as a community, we're a team for you as well. You would be amazed what people will do for you if you ask, or if you let people know what's going on. So we are now part of your team. So what questions can you ask yourself as you're going through this process, not only about everything we're going to talk about today, but just in general? So, do I pay attention to my own needs? Are you a good self-listener? Probably most likely you're not. Do you reach out for help? How many people love to ask someone to help them? One, wow. I was going to say, I didn't think we'd get any. Nice. It's very hard to ask for help, so congratulations. That's really tough to say, it's okay, I need help. It's a hard thing to say. Do I care for myself? So it doesn't matter whether or not you have ALS or you're the caregiver. Do you care for yourself? Do you say, you know what, I need 5 minutes of alone time. You need to go away. I just need to be by myself in my own space. How many people feel like they want to say that? Yes, everybody? It's okay to say that. It's okay to acknowledge, I appreciate you always being around me and helping me, but now it's a little bit of Sarah time. Don't need anybody with me for 5 minutes. That's all right. Do you have a positive outlook? That's really hard sometimes, but that makes a big difference. Do the people around you have a positive outlook? Have you been fooled by anger or emotion? We know emotions are challenging and they can be deceiving because they don't stay consistent. Journal. Write it down. See how you feel tomorrow. See how you feel the next day. A lot of times when you look at something, the day is very bleak, but as you look back, it actually is a progression. So make sure that you're not controlled by those emotions. And then do you take a break? Do you have a support system in place that you can take a break, that you can take care of yourself? I'm not going to read this. It's in your handout. If I read it, I will cry, and I promise myself that every symposium I say I'm not going to cry, and I do. So I'm not going to read this out loud to you, because I will. But read this when you have time. You don't have to do it now. It was written by a caregiver who worked with a loved one who had a neurological disorder. I do not know if it was ALS or if it was Parkinson's, but it was written by her at a time when she felt that she really didn't have control of herself. And I think when you read it, you can put yourself in that position very easily, and it was very powerful. So I wanted to make sure to share that with you, but it's okay to read this, and it talks about falling apart and realizing that we're human. So the other thing I want to address is changing roles. Whether or not you are a child and your parent has ALS, or you are a parent and now your children are dealing with it, or you are a spouse, the bottom line is that the family structure changes, doesn't it? If it's dad who was doing mechanical work and was always taking care of the bills, or doing auto body work on the cars, or mowing the lawn, and now all of a sudden he can't do that anymore, the roles have just shifted, haven't they? And that's really hard, because a lot of people don't know that it has to be talked about. We have to talk about those roles shifting. If mom has ALS and went from caring for her children, cooking meals, making cookies, being part of all the group, and now all of a sudden the daughter is now helping her bathe, that's a hard transition. That's really hard, but we need to talk about that. It doesn't change who we are. It doesn't change us being a mother or a child, does it? It's just that our roles change. Some of the things that we do change. But we need to talk that through. We need to talk about it. And so, to get to the point of today, we normally finish with a big emotional topic about family and goals, and we decided not to do that in this symposium because we want to end on a very positive note. We want to talk about the resources that are available. And I think that that's really important, that we realize that these resources are available to help. Not everybody understands the disease process. Has anyone been to a doctor who really doesn't, they know what ALS is, but they really don't know what it is? I would guess most people would raise their hand, because that's not a specialty that most know about. How about physical therapists? Do you think every physical therapist understands ALS? No. I wouldn't think so. How about dentists? Not at all. So when you're looking for these resources, that really is what the ALS Association is about. I don't care who you choose to use for a resource, but make sure that it's someone who understands the disease process, who's committed to what you're going through, and can be actually a resource. That they're not going to give you misinformation, they're not going to send you down a wrong path and make you frustrated, that they're actually a team member with you. Does that make sense? That's going to make a whole world of difference. So what I want to pull out of your little toolkit is this Caregiver magazine. This is just a general publication, and you can ask the ALS Association, they've gotten that for you, but I think that getting some resources and support is good. And so this is just an example of being able to do a support group, being able to do some periodicals like this, being able to reach out to other family members. Maybe you're not a support group type, but you can find someone who maybe you can go to, go over each other's home and just have coffee or tea or social time. But the point is that you need to start being active. My best example is, if your loved one needed brain surgery, would you just do it? Because they need it? Without any training? Just slice open that melon and go for it? No one's going to do that, right? So why do we provide caregiving skills skills when we don't have any training and we don't know what we're doing. Yet we do it every day, don't we? So that's what this is about. We're actually going to make sure that we're answering questions, we're being, as available as we can to make sure that the day-to-day things that you're dealing with, we're teaching you how to best use those. So we're going to go into the nuts and bolts, I'm going to bring up Amy. Perfect. Amy, come on up. We're going to do another drawing real quick before we move into the next section, so I'll let Amy take it over.
Good morning. I'm Amy D. with Accessible Systems, and just a little bit about us. I think a lot of people here have met our company, but we're Accessible Systems. We're a Colorado local-based company, and we're here to help you live in your home as independently and safely as possible. We do this through different assistive technologies, from stair lifts to vertical platform lifts to ramps to building railings, things that can help you get around within the home. In addition to that, we are a contractor, so we do home modifications. So we'll make your bathroom barrier-free. We'll work with you on your kitchen to make it accessible. And if you aren't familiar with us or have not been to our accessible home, I invite you all to come down and see it. It's in downtown Littleton. We took a 106-year-old Victorian home and we made it adaptable. So you can come and see and test ride and see what the options are. Again, today is about learning about options. So we like to give you options and ways for you guys to kind of see, what's available. So with that,
Here you go.
let's do a little drawing. Thank you for having us too. I've got John, Lauren.
Oh, up the front and close. Congratulations, John. Oh, they're over there. I'm sorry. I switched them so I had this close, so.
We've got a gift card for you to go get your car Mac Daddy washed. Congratulations.
Nice. I'm going to introduce Patty from the VA, and she's just going to talk a little bit about the resources that the VA offers. So,
well, the other thing is that I'm a nurse practitioner at the VA, and I take care of a lot of ALS persons with ALS. So, and I'm a board of directors member. So I'm here today also as a resource to you. Even if you're not a veteran, that's not, I'm here to volunteer. So if you have questions about your medical care or anything regarding medical issues, I'm here as a resource, and you can feel free to ask me today. So I'm to be found anywhere, and then I'm also at a table out there. So please feel free to stop and ask me any questions. Thank you very much.
thanks, Patty. Sorry, I can't lift my arm up that high. No worries. All right, we'll make sure that's off so I'm not squeaking. So, you're welcome. All right, so we're going to get cranking here with general caregiving skills. We're going to talk about the first thing that you're going to hear. Again, we talk about we wouldn't perform brain surgery on a family member because they need it. Same thing with doing general caregiving skills. How many people wear gloves when they're working? Probably nobody, because we think it's our family, right? We don't need to have standard precautions. Well, that's not true. We have standard precautions not only to protect ourselves, but to protect other people. We know that immunities can be compromised, and so by just wearing gloves, we can protect ourselves from passing on something that we may have picked up being out in the community. Does anyone know what happened here before we all came and touched the tables? Neither do I. I'm hoping it's nothing bad, but neither do I. So, we want to make sure that we're taking that into consideration. How many people would go in and let a surgeon touch them if nothing was sterile and their hands weren't washed? I wouldn't. You don't want a massage therapist coming in and touching you with dirt underneath their nails, and not saying that hygiene for everyone here is bad, but the practice is what needs to be done. So to provide a safe environment, washing our hands, wearing gloves, making sure we're cleaning equipment, even if it's used for the same person, you want to make sure that you're cleaning it properly. We go into a lot of homes and we find that people say, oh, well, it's the same suction tube, so we don't need to clean that, or it's the same device that they're using over and over again. But the problem is that at different times when we all touch it, we can pick up things, they can pick up things, and other family members that you bring in can. Handling linens and laundry, that's another huge one that's really important in making sure that that's handled correctly. And then obviously any biohazardous waste. So in your little kit, you will find these. So everybody pull those out, and we're going to have a quick little lesson on how to take them on and off properly. Does anyone know how to do that? Nice, we got a couple people. So you're going to put on your gloves, and I'm going to be a little slow with this hand because it's hard to maneuver this arm. They are latex free. They're one size fits all, but they are latex free. Okay, so when you have your gloves on, everybody got them on? Let's see. Everyone who can? I see gloves. Okay, so what you want to do is you take whatever hand you want to start with, and you're going to pull from the palm of your hand. This is the dirty, right? Everything inside is clean. Everything outside is dirty. You're going to pull from the palm of your hand. You're going to tuck in, and you're going to pull down. Now see, everything here is clean, isn't it? Right? This is all clean. So when this comes out, I'm going to take the clean part, and I'm going to use the clean part to grab the dirty part, right? I'm going to pull in again, and now everything on this side is clean and I have no dirty exposed. Does that make sense? You can practice with that while we talk. You also want to make sure if you have any providers coming into your home that they are using gloves. You don't know what they're bringing in either, so make sure that you're using those to keep everything clean. The other thing that we often forget about is home safety. As the daughter of a part-time fireman off and on in my life, we had fire drills and we had everything unplugged in my home that you can imagine. You had to plug in the TV half the time. It wasn't that bad, but it was close. I was the only 14-year-old crawling out my window at a fire drill at 7 o'clock on a Saturday morning. But this comes from him. So, Dad, raise your hand. He's back there. If you have a question, ask Mr. Fireman there. So, preventing falls, right? We can't stop falls all the time, but we can do something to prevent them. We have the fall prevention table out back. Please make sure that you go out and visit them. Electrical safety is really important, especially when ambulation is compromised. You want to make sure that you've got cords that are safely roped off if there's any fraying. You don't want electrical cords plugged in, one thing and you've got 50 plugs in there. How about telephone access? Does everybody have a cell phone? And for me, like right now, because I don't have mobility in this arm, where would my phone need to be kept? On the left side. On this side of my body. If I put it on this side and I fall, I'm in trouble, huh? Because I've only got movement right now on this side. I only have a little bit of range of motion on this side. I couldn't even reach my back pocket. So it has to be on your good side. Fire safety, another thing. Do you have smoke detectors and are they working? Are they hardwired in? And if they're not, how many people check their batteries on a regular basis? Probably better than just 2 times a year and fall back and fall forward. Might be something that you want to do monthly. How about who has fire extinguishers in their home? Do you know what the expiration date is? Nice. Most people don't. Check it when you get home. Make sure that you know what that is, that you're aware of what that's going to do. Infection control, we already talked about, right? Gloves, making sure that when we're taking care of toileting, we're not carrying something around the rest of the house. We're taking proper infection control. How about medication safety? Do we leave medicines out when we have children coming over, grandkids, dogs, animals? Or are we keeping those someplace that they're safe? Are we keeping them in a closed container? They have to be easy to access for everybody, but they have to be put away. And emergency preparedness. That's not just something that we hear about for fires and tornadoes, but if something happened and there was an emergency and you ran to a hospital and you forgot your cell phone, would your kids know where to go to find you? And I'm not talking little kids. I'm talking, kids my age. If my dad went to the hospital, I'd want to know where he was. Do they know which hospital you would go to so that they could try and find you? Do you have a plan if there's a fire? Do your neighbors know that if there's something going on, that you have compromised mobility, and so if the fire department comes, they know how many people are in your home, there's some posting somewhere? Really important that you make sure that that's something that you're